We say anyone who has a medical crisis has a spiritual crisis. When you find yourself unexpectedly in the hospital are the times when you most need hope, strength, peace, comfort.
Regardless of our role, do we add to the healing? Do we advance the healing? Do we reduce the suffering? Do we reduce any stressors that get in the way of the healing process?
One thing we say sometimes is that the soul is shy, so it takes time. It takes time to be with people and allow them to drop down into their emotions.
I'm really mindful of the fact that that is another human in that bed who's ill and vulnerable and fragile.
I just want to reassure them that they're doing the best job that they can, and I'm here to support them.
Yeah, I think she looks like mommy.
A lot of the time, the patient is looking for somebody who is willing to take time to talk to them, to listen to them, and spend time to solve their problem.
Trying to make that space, whether it's 3 minutes, 10 minutes, or longer. I fully understand how difficult and challenging being here in a hospital can be when you're so used to being at home in your own environment, and really try to connect with them on a one-on-one level.
In order to create a good relationship with the patient, we have fairly short interactions, but we do go and introduce ourselves, explain why we're there. And I'm focused on their medications and trying to make sure that those are the best they can be. But part of that is considering what the patient wants.
And authentic listening to our member patients and to each other so that it's a joyful environment.
I try as I walk around the hospital every day to especially watch out for family members. And if I see someone in the hallway who's crying or looks distressed, I am able to stop and to talk with them.
The first thing I did as a manager was to create a culture of care. That's what we called it, which is patient-centered care. If you're thinking about EVS, you're thinking about what time are they going to collect the garbage. It's based on what the patient would prefer.
I will knock on their door and ask permission. Is it the right time to clean your room?
Hi, Tina. How are you doing today?
When you enter the room, you bring energy here. I always bring a smile.
As care providers, we're taking care of our patients and our members. And as people, we're taking care of ourselves and we're taking care of each other.
Respecting all your colleagues and knowing they have something to contribute. I couldn't do this job by myself. I really need the help from all of my colleagues.
In home health and in hospice, it's a very different environment than in the hospital. And so our clinicians are going out into other people's homes. They're guests in their homes. And so it's very important for them to have their own home inside, that own centeredness inside.
What I tell them is that I'm not looking at your home, I'm not here to judge you, I'm here to support you.
You've done a wonderful job, and I'll see you a little later.
It's because of you.
Thank you.
If we don't see our patients as unique beings, that we are robbed of an experience ourselves, because there's always a surprise, there's always a mystery, there's always a story that we don't know.
Even though we may play different roles, we're all part of the care team or the extended care team, and we all bring our magic to that healing process, whatever it may be.